Anemia is a condition in which there is reduction in red blood cell mass. The normal amount of hemoglobin in male is 13 to 17 gram per deciliter, and in female it is about 12 to 16 gram per deciliter. So anemia is defined as if the hemoglobin level is less than 13.5 gram per deciliter in male and less than 12.5% in female, it is defined as anemia. Then sign and symptom involve weakness, headache, angina, dyspnea, and pre-existing coronary artery disease. Based on the mean corpuscle volume, anemia is classified as microcytic. It means the MCV is less than 80 micrometer, and if the MCV is in between 80 to 100 micrometer, it is a normocytic, and if it is more than 100, it is macrocytic. Microcytic anemia. The MCV less than 80 micron is considered as microcytic anemia. Microcytic anemia is due to decrease in production of hemoglobin. As hemoglobin is composed of heme and globin, and heme is composed of iron and protoporphyrin. So decrease in any of these components leads to microcytic anemia. Microcytic anemia includes iron deficiency anemia, anemia of chronic disease, sideroblastic anemia, and thalasemia. Iron deficiency anemia. Iron deficiency anemia is due to decrease in iron level. Decrease in iron decrease the heme, which decrease the hemoglobin, which cause microcytic anemia. The decrease in iron is due to GI bleeding, the GI surgery, gastrectomy, and increasing demand in pregnancy, and menorragia, which is abnormal menstrual bleeding. Iron absorption occurs in duodenum. The DMT1 transporter on anthrocytes transport the iron across the cell membrane into the blood via ferropotins, and transferrin transport the iron into the blood and deliver into the liver, macrophages, and bone marrow for the storage. So the intracellular iron level increases and bounds to the ferrotin, which is a blood cell protein that contains iron, which prevent the forming of free radical ions via Fenton reaction. The Fenton reaction result in creation of hydroxyl radical from hydrogen peroxide and iron. The clinical findings are anemia, the spoon nails, and PICA. PICA is a psychological disorder that is characterized by appetite for the substance that are not nutritive, like ice, paper, metal, and soil, and conjunctival pallor, which is unhealthy pale appearance. And Plummer-Vinson syndrome. The Plummer-Vinson syndrome is a iron deficiency anemia with the esophageal web, which is the thin mucous membrane across the lumen, which causes dysphagia, and beefy red tongue and the bald tongue. Lab findings: decreased serum iron in the blood is less, and decrease in ferritin level in iron storage in macrophages and liver, increase FEP, the free erythrocytes protoporphyrin, and increase in TIBC, in transferrin molecule in the blood, and percentage saturation is the transferrin molecule that bonds to the iron. So transferrin is increase in the blood and iron is less. So the percentage saturation means the bonding of iron to the transferrin will be less because there is less iron. And increase in RDW, it means red blood cell distribution width, which indicates the nutrient deficiency like folate and vitamin B12. Anemia of a chronic disease. Anemia associated with the chronic inflammation like endocarditis, autoimmune condition, or cancer. And they are most common type of anemia in hospitalized patient. The mechanism involved, either they decrease the lifespan of RBC or either they decrease the production of red blood cells. If they decrease the lifespan, they directly destroy the red blood cell by the toxin from the cancer cell, bacterial infection, and viruses. And if they decrease the production, they do it by following mechanism. Number first is dysregulation of iron homeostasis. Number first is tumor necrotic factor alpha and interferon gamma inhibit the erythropoietin production, which decrease the red blood cell production. Now, tumor necrotic factor destruct the red blood cell via process called phagocytosis, and interferon increase the expression of DMT1 receptor on macrophage surface to increase the iron level inside. So there will be less iron extracellularly, which is less for the hemoglobin production. The interleukin 10. The interleukin 10 mediates the ferritin receptor on macrophages, and interleukin 6 increase the hepcidin level in liver, which block the further uptake of iron from small intestine. The lab findings: decrease in serum iron and increase in ferritin level, mean iron stored in macrophages and liver, decrease TIBC, mean transferrin molecule in the blood, and percentage saturation is also decreased because of decrease in TIBC and increase in ferritin, and increase in FEP, the free erythrocytes protoporphyrin. Thalassemia, anemia due to decrease in synthesis of globin chain of the hemoglobin. Decrease in globin chain decrease the hemoglobin, which called the microcytic anemia. Normal hemoglobins are hemoglobin A, which is most common in human adults, hemoglobin A2, and hemoglobin F, which is a fetal hemoglobin. The carriers are protected against Plasmodium falciparum malaria. They are divided into alpha and beta thalassemia, which is based on decreased production of the alpha and beta chain. The alpha thalassemia is usually due to gene deletion. Normally, there is 4 alpha gene on chromosome number 16. The 1 gene deletion is usually asymptomatic. The 2 gene deletion is having mild anemia, and there is increase in red blood cell count. And the cis deletion is a deletion of a gene occur on the same chromosome, which is most common in Asian people, and transdeletion is the deletion which occur on the different chromosome, which is most common in American and African people. 3 gene deletion. Person having 3 gene deletion has severe anemia, and their beta chain form tetramers called HBH, which damage the red blood cell, and these tetramers are seen in electrophoresis. 4 gene deletion, they are more lethal in hydrocephalus. Hydrocephalus is the accumulation of the fluid into 2 or more fetal compartments like ascites, pleural effusion, pericardial effusion, and skin edema. And their chains form tetramers called HB part, which is also seen in electrophoresis. Beta thalassemia. Beta thalassemia is usually due to gene mutation, either mutation on the promoter site and the splicing site. They're most common in African people, and there is 2 beta gene present on the chromosome number 11, which in mutation result in absence of the beta, or maybe there is a diminished beta production of the beta globin chain. They are divided into thalassemia minor and thalassemia major. Thalassemia minor is the mildest form of the disease, and they are usually asymptomatic with increase in red blood cell count. They are diagnosed with the increase in HbA2. The normal level of HbA2 is 2.5% and increase reaches to the 5%, and decrease in HbA, which is most common in human adults, and increase in HbF. So the electrophoresis shows increase in HbA2 and increase in HbF. The microcytic and hypochromic red blood cell are seen on the blood smears. Thalassemia major. Thalassemia major is the most severe form of the disease and present with severe anemia a few months after the birth. So the high fetal hemoglobin at birth is temporarily protective. So the tetramer aggregates damage the red blood cell, which result in electrophoresis and extravascular hemolysis, which is the removal of circulating red blood cell by the spleen, and erythroid hyperplasia. Erythroid hyperplasia is the immature red blood cell in the bone marrow, which is abnormal in size and number. It is caused by vitamin deficiency or chemotherapy, which result in hematopoiesis in the skull and chipmunk faces. And the third one is extramedullary hematopoiesis with the hepatosplenomegaly. The extramedullary hematopoiesis is a cause of splenomegaly in the bone marrow disease, like myelofibrosis, which is the bone marrow cancer that disrupt the normal red blood cell production, and osteoporosis is a disease that make the bone dense and easy to break. The parvovirus B19 trigger the acute cessation of red blood cell production, causing aplastic crisis or aplastic anemia. Aplastic anemia is the damage to the hematopoietic stem cells. So these viruses damage the hematopoietic stem cell, result in anemia, thrombocytopenia, leukopenia with the low reticulocytes count, and chronic transfusion leads to the secondary risk of hemochromatosis, which is the iron buildup, and the blood smear shows microcytic hypochromic red blood cell, and electrophoresis show increase in HbA2 and HbF, which is the fetal hemoglobin, and there is no change in hemoglobin A. Sideroblastic anemia. Anemia due to defective protoporphyrin synthesis. Decrease in protoporphyrin decrease the heme, decrease the hemoglobin, which cause microcytic anemia. The protoporphyrin synthesized via a series of reactions. Number 1, ALAS aminolevulinic acid synthetase convert the succinyl coenzyme, which is formed in the Krebs cycle, converted into ALA aminolevulinic acid with the help of cofactor B6, vitamin B6. Number 2, ALAD aminolevulinic acid dehydratase convert ALA into prophobilanogen. And number 3, prophobilanogen into protoporphyrin. And number 4 is ferrochelatase attached to the protoporphyrin to iron to make the heme, which is finally occur in mitochondria. Now, lead inhabits ALAD and ferrochelatase. So this iron is transferred to the erythroid precursor and then enter into the mitochondria to form heme. If there is decrease in protoporphyrin, that iron trapped in the mitochondria. So these iron laden mitochondria form the ring around the erythroid precursor cells called ring sideroblast. The sideroblastic anemia can be congenital or acquired. The congenital defect mostly involve ALAS, which is the rate limiting enzyme, and acquired cause alcoholism, which is mitochondrial poisoning, and lead inhibition, which inhibit ALAD and ferrochelatase. And the third one is vitamin B6 deficiency, which is required as a cofactor when succinyl coenzyme is converted into ALA. Vitamin B6 deficiency is also seen in a patient of tuberculosis who is taking isoniazid as a treatment. So laboratory finding is increase in ferritin, decrease in TIBC, which is the mer of the transferrin molecule in the blood, and serum iron increases and increase in percentage saturation.